evening. Welcome to ITV News Anglia.
Here's a look at tonight's main stories.
We'll be finding out how this state-of-the-art piece of surgical equipment, the width of a pencil, is treating people in Northamptonshire with debilitating spine issues.
Hello from Russell and from me, welcome to the programme.
Next, the groundbreaking surgery which is changing the lives of people with severe back issues.
When Hannah Martin was left without the use of her left leg because of a spine issue, she feared the worst. But thanks to a new, less invasive procedure at Kettering General, she's back on her feet in less than a week. And
with the latest NHS data showing that as of December, more than 13,000 people in England waited more than 18 months to start planned treatment. It's hoped it could help reduce the backlog, as Sophie Wiggins reports.
So my left leg, there was pretty much no movement at all, but now I can move it pretty much exactly how I should be able to move it.
You can hear the relief in Hannah Martin's voice. Around 6 months ago, the 31-year-old housekeeper from Rushden started losing the function of her left leg, having to resort to dragging it around. Caused by a herniated spinal disc, it had started to really impact her life.
I felt that I was letting my family down, like my kids down. They wanted to go out and do stuff and I couldn't do it. Even like walking around the shops, I really struggled to do that. Or, just saying the words, "I'm really sorry, boys, but I can't carry on." It was awful.
On January 31st, she became the first person in Northamptonshire to have a new type of disc surgery. It's less invasive and the patient can potentially recover within a week instead of the normal 6.
This surgery has been life-changing for me. By the time I'd got up to the ward, my feet, I could move them. I'm excited to go back to work. I'm excited to do things with my kids again. Just to be able to move, it's just fantastic. It really is.
And you feel like you get your leg back.
Yes, I get my leg back and my life back.
This is the treatment centre where Hannah had her operation here on the site of Kettering General Hospital. It's one of just 10 hospitals in the UK to have performed this procedure on a patient. The surgeons here make a small incision and use this pencil-thin endoscopic camera and the tools within it to pull out the damaged disc. It takes just 20 minutes.
A small incision, the risk of infection is much lower because we're damaging less to the tissues. The blood loss is very minimal, barely anything. And the precision that we're exactly locating it, cross-checking with x-rays, cross-checking with an endoscope. And that's good for the patient because they're up and about within a few hours and they go home probably in a few hours' time. It's very good for the patient.
Me and Shri, I've been thinking about it for at least a decade.
Coming to fruition at a time when the waiting list is at capacity.
At the moment, we have stopped all incoming referrals because we were swamped with work. At any time, we would have in excess of 100 patients on the waiting list, and often it could be up to 9 months to a year, before a patient can have a back operation.
So could an advancement in surgery like this potentially help lower backlog for operations like this in the NHS?
I think so, because we'll be able to fit more cases in a day. So I can certainly see that happening in due course.
With surgery generally a last resort, they're starting with a handful of patients with specific issues and say they hope to take on more complex cases soon. However, the difference this surgical leap is having already, well, the proof is in their patient, taking steps she couldn't a matter of days ago. Sophie Wiggins, ITV News, Rushden in Northamptonshire.
Never has wiggling your toes felt so good.
What an exciting development. We'll
Yeah,
certainly
great.
watch
It's
that.
happening in this region as well.
Yeah, right. Let's take a look at what we've got for you in the second half of this evening's programme.
That's all from us. Have a good evening. Bye-bye.